So to debate this now, I'm joined by Sonia Poulton, the writer, broadcaster and social commentator, who says there are disparities in the way coronavirus is tested and Prince Charles absolutely should not have received one. And also Rob Jobson, who is the royal editor at the Evening Standard and the journalist who is closer to the Prince of Wales, who says it's ridiculous to suggest he shouldn't be tested, given he's the future head of state. So, Rob Jobson, let me bring you in here first. If we are to believe that Prince Charles only had mild symptoms, the government advice is that you self-isolate at home and you don't get tested. So can you understand why some people are suggesting there may be a disparity?
Yeah, of course there is, but they've gone through the procedures in Scotland, and they've met the criteria as a man over 71, and that's what's happened. But you've got to also ask yourself here, Dan, what is the reason people are being tested? The reason they're being tested is to find out whether they have the virus, so that then, once you find out if they have the virus, you can connect with the people that they've spoken to over the last 14 days. Well, one of those people that he spoke to the last 14 days was his mother, Her Majesty the Queen, who's the head of state. So I think it's imperative that he was tested. And if you're just saying that he shouldn't be because he's the heir to the throne, I think that's ridiculous. The reason you're testing someone is to find out whether or not they have the virus. He has the virus.
No, absolutely understand that. But Sonia Poulton, your point is that if he were an ordinary 71-year-old, a non-royal 71-year-old, maybe in a council estate.
Indeed.
There's
Indeed.
No chance he would have been able to be tested.
You know, by their own admission, he has mild symptoms, and yet he passed that criteria for testing on the NHS. Now, there are millions of people who will be eligible, no doubt, but why did he get priority? Because he is Prince Charles. And so his privilege counts even in a pandemic. And if you think about other over 70-year-olds, they have to go out to the empty, shelf-ravaged supermarkets. They're far more vulnerable. He already broke rules by going off to Balmoral, another country, England to Scotland, on Sunday, even though they admitted he was feeling poorly over the weekend. So how much more privilege does he want to wave in our face? I should say to you, Dan, I'm speaking to you sitting in my pyjamas, in bed. I'm also poorly. I'm self-isolating. I'm not near the age of Prince Charles, thank goodness. But I wouldn't dream of going out and troubling our health service at this stage when I can take care of myself.
So, Rob Jobson, how do you respond to that? Sonia Poulton is actually saying here Prince Charles has been irresponsible. He's even been irresponsible moving to Scotland temporarily.
I hope that you get well soon. And
Thank you, Robert.
I'm well myself. I've been self-isolating and have not troubled the health service either. But I do believe that we are being slightly naive if we think that leaders of our country and other countries are not being treated with privilege. If the President of the United States and the Vice President of the United States are tested randomly, the wife of the Prime Minister of Canada is tested. You know, this is, I mean, unfortunately, I think this will go...
Multiple professional footballers have been tested.
Yeah, and that's probably because they got more money. And the bottom line is, and I don't think it's right, and I feel for people like Sonia on this, because, you know, I'm doing exactly the same thing. And I know, Dan, you're working not in an office, and we're all trying to achieve the same thing here. But the reality is we're not on a level playing field. If you are a member of the royal family who's been in contact with the Queen, who is 94, and I must be honest, I'd give up my place to be tested to make sure that she was tested. I hope she has been, and I hope that she is well, because, you know, for someone who has led our country in such inspiring way for the years as Queen, over 70 years, I think it would be wrong that she's not given some full priority. Now, the Prince of Wales has got it. Thank goodness we found out that he has got it, because he has been in contact with the Queen. The last contact was on the 12th of March. The Queen is at Windsor with her nearly 100-year-old husband, Prince Philip. Now, all of these people may seem privileged to others, and I agree that they are, and I'm sure that they would agree too, but they are very significant people in our society, and they are people that people want to wish well and lead us in this way. So I think that given that he had contact with the Queen on the 12th of March, and given that he has now tested positive, which is after all what the test is about, it was important that he was tested.
So, Sonia,
Robert,
what about...
Robert,
sorry, you go. You respond,
Yes,
Sonia.
sorry, Robert, that was over 2 weeks ago, and we do know that symptoms emerge within that time. But leadership is actually really important. That's really key, what you're saying. And as a future king, wouldn't it be amazing leadership if Charles had turned around and publicly said, my need is not so great, my symptoms are mild, I will be tested after our essential service heroes have been, and imagine what an impact that would have made.
I agree with you.
And reassured the people that even though he was born into privilege, he is prepared to try and relate to the public. You know, Charles and Camilla have been blessed with great luxury of a castle and the absolute best in food and care, and their quarantine standards are the stuff of dreams.
Yes, and Robert, weren't they irresponsible for not self-isolating earlier?
You've got to put yourself in the position. He flew up on the Sunday when he had the symptoms when he arrived. That's what we're told. And that he had the test on a Monday. Now, I agree with what you're saying. I think that if the Prince of Wales had a choice, he would do exactly what you're saying. I've written about the Prince of Wales. I've travelled with him, and I know that he's a very genuine person. If he had had a choice to do what you're saying, I personally think he would do that. But I don't think he would have been given that opportunity or that choice.
Interesting.
And Sonia,
Robert, I don't know from that perspective. So you're telling me that the Prince of Wales would have been forced into having a test?
I would say that he would be very, very heavily advised to have the test, yes.
Yes, and the people around him would have been saying, you've got to think of the people you've come into contact with. Sonia,
number one, they would have done, yes. But also, because of his position, they would have said, you're going to have the test. Now, don't be under any illusion that our leaders in politics have not all been tested either. And if they were asked direct questions, I'm sure that most of them have had the test.
Well, some of them have been. Some of them have been, and they've admitted it. Sonia, don't you also appreciate the point that actually the royal family tried to stay in London as long as possible because they're famed for their keep calm and carry on mentality, and that did put them at risk?
Sorry, Dan, are you talking to me?
Yes.
Sorry, it cut off momentarily, and that put them at risk. Yes, but we're being told it's even government advice not to travel, and they chose to travel. We're all at risk. I mean, what this has really blown open is how at risk we actually are and the impact of long-term austerity on our National Health Service, because really, none of us should be quibbling about anybody getting a test if they have symptoms. Absolutely. That should be an absolute given. But you only have to look at
the lack of testing is an outrage. The lack of testing is an outrage.
It is an absolute outrage, and that
is
why
we were told, weren't we, that we'd be looking to 25,000 to 250,000. I heard today that we haven't even reached 5,000.
I know, and I know. And here's the problem, Robert. It's not necessarily Prince Charles's fault, but unfortunately, he's now become the poster boy for the privileged getting tested, while the underprivileged are left to rot.
Well, exactly.
Yes, I hear that. I do hear that.
And it's not his fault.
Workers, though. What about the royal workers? Are they going to be tested?
They're in isolation now too. They probably, they're not going to answer the questions on that, but I'm sure anybody who's in close perimeters to both the Queen and the Prince of Wales would have been tested. The questions have been asked by us, but they've not been answered. But the reality here, all I'm saying is that when he did fly, and it is a matter of, yes, he does have privilege. He is a prince. I mean, the bottom line is his personal income is something like £24 million a year.
Right.
So if he wished to fly up there, he would. He flew up on an RAF flight. It wasn't a commercial flight. There would have been no close contact with anybody else apart from the Duchess of Cornwall. But I hear what you're saying about irresponsibility, and I would like nothing more than to be in isolation in the Highlands of Scotland rather than in Roehampton. But there's anything wrong with
But the people around him, Robert, will be wanting to keep him safe, and there is good
reason behind it. They would have to. That is their duty of care. That is their duty of care, and it won't be because of his position in the constitution of this country. Then, of course, he's going to have certain privileges that you, me, Sonia don't have.
So clearly, then, this coronavirus is not the great leveller because we are not all treated equally. That's the reality.
We're not. We're absolutely going to be. So all I would say is make sure that we're not being treated equally, and we don't have £24 million a year coming in. Stay indoors. and take the medicine instead by staying away from other people. That's all we
Right.
Robert, I was speaking to Angela Levin just before the news, and we both have a theory on this. And you obviously know Prince Charles very well, and you know his team very well. But our theory, and I should point out it is only a theory, that for Prince Charles to be tested, we believe he probably is suffering more than simply mild symptoms, and potentially he's been suffering for some time, but they only went public today. Do you have any insight on that? Because, of course, it was March the 10th that he was with Prince Albert of Monaco,
right.
who obviously has been suffering coronavirus for some time.
My feeling on that, Dan, is you're probably not far away from the truth. You know, let's be honest, what we're hearing on the BBC and all these other outlets, not talk radio, we're getting to the hub of it here, but we're getting what the government want to tell us most of the time. And when the second paragraph of the Evening Standard paper tonight was that the Prince of Wales is at his desk, he's working in his room. Well, of course, that is the message, working from home, that they're trying to tell us.
They want to keep us calm.
Everyone to get that on message out there. Now, we are, most of us, working from home.
But that's a PR failure, isn't it? Because that's backfired, because people are now going, well, if he only had mild symptoms, why did he get tested?
I know. I suspect, given, I know the Prince failure, he would not have just said, I've got a slight cold, I feel a slight cough.
Exactly.
Getting tested. That's the last thing that he would do.
That's the point. And it has backfired on him potentially from a PR point of view. I think you're right, Sonia Poulton. At the same time, I just wish sometimes that public figures in these situations would be honest, because if they are unwell, it's better that we know. And look, we go right back to the assassination attempt on Ronald Reagan when he was close to death, and the American people were never told about it. So, look, Robert, I hope Prince Charles is fine. I hope the reports are right, but you can understand why I don't entirely trust them.
I find it very strange, Dan, that given that the Queen issued a message, I find it very strange, and I know that it really has to come from Boris Johnson and Number 10 about when the royal family speak, but they've been extremely quiet. They're not normally this quiet. The Queen has not been seen, apart from getting out at Windsor. She's issued a piece of paper in terms of a statement, and I would have expected the Prince of Wales to have gone on television in some time after the Boris Johnson addressed the nation to sort of help calm the nation.
Yeah.
But he couldn't. And the very fact that he hasn't suggests that he probably isn't all that mild, but he is okay.
Absolutely. Fascinating debate, fascinating insight too. That's Rob Jobson, the royal editor at the Evening Standard, also the journalist who is closest to Prince Charles, the 71-year-old heir to the throne. Before that, Sonia Poulton, the writer, broadcaster and social commentator, who says, hang on a moment, coronavirus was meant to be a great leveller, but it's not, because the underprivileged can't get tested, but Prince Charles can be. So what do you think about that? Gosh, so much feedback coming in. Jenny says, shame on you. Put the full story. Prince Charles sat opposite Prince Monaco recently, who tested positive for COVID-19 last week. Prince Charles is also of a vulnerable age. Others in similar situations get tested on that basis, and they aren't royal. Not to mention, his 93-year-old mother is our queen. And I do accept that. I do accept that. But at the same time, I also accept that there are people who see it as unfair. For example, Mike, who's tweeted to say some Wally wearing a crown gets a test before a nurse. It's ridiculous. So it's a fascinating debate, and our poll results are very, very close. But in fact, over the course of the debate, the people saying no, Prince Charles should not have been tested have actually gone up. 54% of you now saying no, just 46% saying he should have been tested.